My name is Dr. David D'Souza. I'm a radiation oncologist at the London Regional Cancer Program, Victoria Hospital, London Health Sciences Centre, and an associate professor at Western University as well. So brachytherapy is an interesting word, and sometimes people have trouble pronouncing it. It comes from a Greek word, which brachy meaning short and therapy meaning treatment. So it means treatment given at a short distance. And in practically what it means when we use this brachytherapy is we use radioactive sources, which can either be put into a patient on a permanent basis or a temporary basis, and they're implanted into the tumor or the tissue that we want to treat. We deliver brachytherapy by a very tiny radioactive source, usually no matter what type of procedure is done. For prostate cancer, it would be best described as a small thin grain of rice that is implanted into the patient. And the advantage, of course, of putting it into the tumor is the radiation falls off very quickly from the source itself. So it helps to spare tissues that sit around or outside of the prostate, which in this case, of course, would be the rectum and the bladder. So it can help to reduce the side effects or problems that patients have compared to other forms of radiation, which require the beam to travel from the outside in. The other advantage is we are actually placing this into the prostate, so we know exactly where it is. It's easier when it's placed in and to treat it from the inside than trying to aim something at it. It would be much like trying to shoot a gun many times and hope that you hit the target accurately. Things can move, and knowing that it's embedded in the prostate also helps us give a high dose. So the robotic-assisted device is something that we have developed here in London in conjunction with our partners at the Robarts Research Institute. And typically, prostate brachytherapy has been done by a physician depending on their skill or their hands, of how well they can do the procedure. What we want to see is incorporation of a robotic device. And you may wonder, why is that going to help things? Well, there's a variation in quality of what can happen in terms of brachytherapy, and it is thought even the best person occasionally may not perform a very good implant. Sometimes just taking out the uncertainty, just like there's robotic-assisted surgery, having a robot doesn't mean a robotic assistance means that a robot does the surgery, but it gives a more precise way of delivering treatment to the patient. So in our case, it allows a needle to be more accurately or precisely placed into the prostate to deliver the seeds or the radioactive sources exactly where we want them to go. It also allows us to do something which we can't do right now. Normally when we implant a prostate, we have a template. It kind of looks like Battleship, that it's square and it's got holes in it, and we put needles through the holes according to a system of coordinates to cover the prostate. The problem is we can't put needles in at angles, and a robot-assisted device can help us do that. And that will have advantages for treating some men who have larger prostates who right now cannot have the brachytherapy procedure. We are excited about the possibility of starting our first case by the early spring of 2014, and we anticipate the 10 patients that we have asked for to do on this clinical trial to be accrued over approximately the next year. So the long-term goal of the clinical trial is to show that, one, it is safe, this is called a phase 1 trial, so the first thing is to show that it is safe, and the second thing is that it's feasible. If we can show that those two aspects are there, I think most people in the prostate cancer field will acknowledge that brachytherapy is a very effective treatment. So the funding that we have received from the Motorcycle Ride for Dad, we're very grateful for. It has helped us what we would describe as the initial stages of getting things started up. It's being used to develop the software, the computer software that is necessary to use this technology with the robotic assistance. The second aspect would be special needles that will be required for this type of a case to pay for that as well. We are most grateful for the support from the London chapter of Motorcycle Ride for Dad. Without their support, I don't think we could start something like this. Even more gratifying is that a group like this cares about the research we're doing and understands our passion in trying to improve outcomes for men with prostate cancer.